Neurology Quiz number 87. Discuss the etiology, clinical features, and management of dopa-responsive dystonia or Segawa disease. Dopa-responsive dystonia or Segawa disease is a childhood-onset dystonia with a dramatic and sustained response to low doses of levodopa. It shows autosomal dominant inheritance with incomplete penetrance. It results from a mutation in the GCH1 gene on chromosome 14. The GCH1 enzyme is involved in the synthesis of tetrahydrobiopterin, which is a cofactor for tyrosine hydroxylase, the rate-limiting enzyme in the synthesis of levodopa. About 30 to 50% of patients do not report a family history of the disease. De novo mutations are also possible. Recessively inherited DRD is due to mutations in the gene for tyrosine hydroxylase. Patients manifest with low levels of tyrosine hydroxylase and low levels of dopamine. This is much less common than the dominant type. Clinical features. Girls are affected 2 to 4 times more frequently than boys. The condition begins in the first decade of life. Average age is 6 years. It usually starts with insidious dystonic posturing of one leg. Most commonly, there is flexion inversion of the foot or equinovarus posture with stumbling and falling. It then progresses and can range from mild focal to disabling generalized dystonia associated with prominent gait disability and postural instability. A characteristic feature is diurnal fluctuation. Affected patients describe being almost normal in the morning, become progressively more disabled during the day, with peak disability late in the evening. Symptoms may also be worsened by physical exercise. Some patients, especially those with onset in adolescence or adulthood, develop Parkinsonian features including bradykinesia, rigidity, and postural tremor. There is no effect on cognitive or intellectual functioning. Diagnosis. This is based on the characteristic clinical presentation and the dramatic and sustained improvement with low doses of levodopa. CSF shows reduced levels of both total biopterin and neopterin in the dominant type. Reduced levels of GCH1 in blood cells is also noted. Molecular genetic testing can identify a mutation in the GCH1 gene. Differential diagnosis includes cerebral palsy, hereditary spastic paraplegia, early onset dystonia, and early onset Parkinson disease. This figure shows generalized dystonia involving the neck, trunk, upper and lower limbs at rest, and complete disappearance of dystonic posturing after levodopa trial. This video shows a patient with dystonia of the feet and difficulty walking. This is a follow-up video which shows complete subsidence of the dystonia after patient was treated with small doses of levodopa. Treatment. The condition shows a dramatic and sustained response to levodopa therapy. Patients respond very well to low doses of levodopa, 100 to 300 milligrams per day. Motor fluctuations and dyskinesias associated with chronic levodopa use in Parkinson's disease are rare. Improvement in symptoms can be noted after a few weeks to a few months, and treatment is lifelong. Other medications that can be useful include dopamine agonists and anticholinergic agents. Prognosis. There is no decrease in life expectancy. Typically, there is complete and almost complete resolution of symptoms with administration of levodopa.